Indiana is unhealthy. Indiana actually leads the country per capita in fast food restaurants. It is 5th in smoking. It is 11th in obesity. It's 12th in diabetes. And it is in the bottom half of any of the preventative measures you can take. I was faced with an unhealthy workforce that resulted in continuing rising healthcare costs. There's 2 ways to handle medical costs. Cost shifting, you put more on the burden of the employee, but that never addresses the root cause, because there's only one way to control healthcare costs. You keep your people happy and well, they won't have to use the plan.
The companies bring us in initially because their healthcare costs are quite high, and typically their insurance premium rates are in the double digits. We typically, in the first 6 to 12 months, help lower those insurance premium rates down to the single digits or negative digits. However, the reason they keep us, that I believe, is not only because we continue to keep the healthcare costs low, but that it's a program that allows the employee to know that the employer really thinks about them and really values them.
The employer clients actually pay for our services, so our services are free to the employees. Not only makes them healthier, it saves them money. We charge for our service, but the return on investment for our clients, our employer clients, more than cover the costs. So we don't cost employers anything. We actually improve their bottom line.
That's our number one cost in this company is healthcare. Number one. And when offered this program, I was skeptical. After the first year, it was a roaring success. People who would never see a doctor were now having to see the nurse. I think they felt good about themselves.
I feel better because I have had a heart attack, so I have to keep a close watch on my health. And I just go to my heart doctor once a year and my family doctor once a year. So this really fills in 11 extra visits that I wouldn't get to make because of being able to afford it or whatever.
Employees who start to go see the nurses sometimes have to go many times before their behavior changes, and that information that they learn from them and those decisions they make may take a year before they have real behavior change. But we see every day on the elevator, somebody will say, I say, hey, you look pretty good, and how's everything going? He's like, great, I'm going to see the nurses next week, so I really have been watching what I eat, and I think they'll be excited because I lost 10 pounds. And that kind of accountability from month to month or every 2 months has really also helped. So it's been a very positive program overall for our company and our employees.
A lot of people just feel that they have no control over their health, that it's their family or it's whatever. They just don't have a control over it. And part of that is our society, because we are very medicine driven, that the control of any disease is medicine. And they don't truly understand that it's lifestyle decisions. In fact, most chronic diseases, about 85% of chronic diseases are due to lifestyle decisions. When we speak with employees, our message is, you're in control. We want to help you be in control. We're not here to tell you what you should do. In fact, one of our hallmarks is we almost never use the word should. Small changes make big differences, and when they see small changes making differences, then they get excited that in fact they can have some control over their health.
I had an experience come about that they caught something on a medical condition that I wasn't aware of. Started climbing up on me probably within maybe a 6-month period. And she suggested that I go have it checked out more thoroughly, which I did. I found out I was diabetic. It was quite a shock. Happened on my birthday last year. So it's a very borderline type thing, but if it hadn't been for them, I wouldn't have found it.
Everything we do is nursing, and it's actually the basis of healthcare as we all learned it as students, whether we were med students or nursing students. It's the basic kind of information, the basic kind of care that we share with our employees, our patients. But it's truly getting back to that, the basic needs of people, including exercise and diet and sleep and stress and management, that we're really dealing with day in and day out. And if we don't have those under control, then our health is affected.
If every company had an RN who was able to teach, coach, support in the manner that our RNs do, the workforce would definitely be healthy and healthcare costs would be controlled.
An employee will come in and they'll have changed their cholesterol to the normal level. And the joy that I see that they have and the hugs that I get are just, the reason I keep doing this. So, and I know we're changing people's lives and putting them back in control of what they can do and hopefully improve their quality of life. And that's what it's all about, and that's what nursing's all about. So that's why I'm a nurse.